At Smile Digital Health, we're renowned for our flagship health data platform. What you might not know is our expanding range of products designed for seamless interoperability. These solutions unify data from diverse sources and standardize it, enrich it for optimal use, and elevate insights through clinical reasoning capabilities. Our suite includes digital quality measures and clinical guidelines, ensuring compliance with regulations and best practices. Today, we demonstrate an end-to-end patient journey across 4 parts, integrating products to showcase Smile's comprehensive capabilities. Firstly, we aggregate and standardize data from multiple sources. Next, we apply clinical knowledge to identify and address care gaps. Then we automate prior authorizations seamlessly. Finally, we demonstrate patient record portability for international travel, highlighting our interoperability solution. Our use case focuses on colorectal cancer screening guidelines, illustrating how our solutions adapt to complex patient scenarios. Meet Miss Agnes Herman. She's 57 years old and recently relocated from California to New York and needs seamless healthcare continuity. Her journey begins with integrating her prior medical records into our system to inform current clinical decisions. Ms. Herman is a likely candidate for a colorectal cancer screening, being over 45 years old. Her new doctor has no prior knowledge of Ms. Herman and needs access to her records to learn about her patient. Currently, the EHR shows no flags or reason for concern because there is no information on her prior history. With Smile CDR, our system has a digital quality measure for colorectal cancer screening to identify care gaps. In this mockup, it begins by ingesting information from various sources from California and updates the EHR. First, the information flows in and gets sorted. XML files will get identified as a CCDA and will travel to our CDA Exchange module to be transformed into FHIR and stored into a FHIR repository. If it's a V2 message, it will go through our V2 transform module and be transformed and persisted into Smile. As information gets stored, the last step is post-processing. There's an event-driven architecture that's designed into Smile that listens to pieces of information and performs calculations and drive insights for downstream use cases. Now let's go back to the EHR and see what happened. Reviewing Ms. Herman's case in our mock EHR, we identified gaps in her medical history, highlighting the need for integrated data to enhance decision-making. Our care coordinator identifies risks post-data ingestion, triggering proactive patient engagement to close care gaps. The care coordinator calls Ms. Herman to set up an appointment to see the doctor in the next few days. Let's review our journey so far. Ms. Herman relocated from California to New York. The New York clinic uses Smile's integration capability to unify various sources of data into a clinical data repository. Now, using Smile's Clinical Quality Improvement Suite, we have derived digital quality measures. In this case, a care gap, to identify colorectal cancer screening for Ms. Herman. Now Ms. Herman's at the doctor's office. At the doctor's office, our clinical decision support tool aids in Ms. Herman's diagnosis, leveraging integrated data and clinical guidelines for informed decision-making. You can see the type and source of data populated from various sources through the integration. Clicking on the Resolve Care Gap button launches the Clinical Decision Support Tool by Smile. It is a smart application that's compatible with modern EHRs. It uses computable clinical practice guidelines in FHIR and combines it with Ms. Herman's medical record to recommend the next best action for the doctor. The tool is adaptive, and with a simple click of this selection, the logic reruns with a new set of parameters. As we continue, you can see that the prior authorization required flag is on the procedure. In Ms. Herman's patient record, we have her payer's information, and her payer also has a FHIR server adhering to the prior auth specification. In this scenario, we've achieved true interoperability between the provider and the payer. Using clinical reasoning, the payer has implemented similar decision logic to determine if a procedure requires prior authorization. Let's select the colorectal screening and send this to the order screen of the EHR. Now we're on to our third pillar of our demo, which is using FHIR solutions for e-prior authorization. Here is the order screen on the EHR. You can see that the procedure we selected through the Clinical Decision Support tool is here, and it indicates prior authorization is required. Let's click on it. Here we will launch a SMILE prior authorization solution. Our adaptive clinical decision support tool guides Ms. Herman's care journey, ensuring informed decisions align with clinical guidelines and patient records. Being interoperable with the payer, the application requests the specific documents to be filled for prior authorization for this procedure. Real-time adjudication by the payer ensures efficient decision-making, validating the procedure and advancing Ms. Herman's care journey. Our e-prior authorization solution streamlines this process, integrating seamlessly with modern EHRs and ensuring compliance with payer requirements. With prior authorization secured, we proceed to schedule Ms. Herman's procedure through our integrated EHR system. The clinician completes and submits prior authorization documentation, leveraging SMILE's interoperability to streamline healthcare processes. Now in the demo, we'll trigger an HL7v2 message to mimic that the procedure has been completed by Ms. Herman. As mentioned before, SMILE identifies this message type as a V2 message and runs it through the HL7v2 transform module, which will then be persisted in our FHIR server. Then post-processing will analyze this new piece of information. Returning to our EHR, we confirm Ms. Herman's completed procedure, closing care gaps and ensuring updated patient records. On the Care List tab, the care coordinator can see that Ms. Herman is good. On the patient chart, Ms. Herman now has a green checkmark for colorectal cancer screening. Digging into the details, as we scroll down, we can see the screening was ordered and is displayed here, and the result is negative. This is due to the post-processing that took place as this V2 message came in, was transformed into FHIR, conducted recalculations on the care gap, and closed it. Ms. Herman would love to travel to London, but just in case of emergency or accident, she would like a copy of her patient record to take with her. Luckily, SMILE has an international patient summary solution. Our fourth pillar showcases SMILE's international patient summary solution, enabling seamless access to Ms. Herman's health record for travel and emergencies. Accessible through our patient portal, Ms. Herman generates an international patient summary by selecting the Generate IPS button, ensuring essential health information is readily available during travel. This easy share solution at SMILE generates a QR code that can be scanned or stored with Ms. Herman as an image. Clicking on the QR code generates a minimal data set of her international patient summary. This international patient summary is a joint effort across key standard development organizations such as CEN-TC 251, IHE International, SNOMED, HL7 and ISO. The International Patient Summary aims to standardize the minimum health record a patient should carry with them as they travel and need health care. Our solution supports global health standards, providing a minimal health record for international travel and emergency healthcare needs. SMILE's interoperable solutions drive comprehensive healthcare management, enhancing patient outcomes through integrated data and actionable insights in order to provide better global health.